My name is Dr. Alexandra Getz, but most of my patients call me Ali or Dr. Ali. I'm currently a full-time private practice general adult psychiatrist. I was trained in the NHS, and up until the middle of May 2026, I worked both in the NHS, in community and inpatient settings, as well as in private practice. I became a doctor because I always wanted to be a psychiatrist. I've been interested in the mind, in human behaviors, in motivations, desires, dynamics from a very young age. As I continued with my studies, I came to realize how broad the subject of psychiatry is, and that has meant that I have had a very interesting and versatile career over the years. For example, I've spent time managing secure wards in forensic settings. I qualified as a dialectical behavioral therapist and managed units for women with borderline personality disorder. I've been involved in steering strategy and governance across inpatient services. I've worked in very busy London community mental health teams with high caseloads of very complex, vulnerable, risky patients. I have assessed and treated autism and ADHD for years, both within NHS and private practice. And I have a long-standing and busy medico-legal practice where most patients I interview have experienced either early life or more contemporaneous trauma. Why do I like psychiatry? I'm never bored, which I understand is rather rare in many professions. I love talking to my patients, trying to work out with my patients what they're struggling with, arriving together at accurate formulations, and then coming up with a treatment plan that actually works. I have had many patients who I've worked with for years and in whom I've seen real change. I think my patients value my honesty with them, which is my commitment to them, as well as the effort I put in truly trying to understand them as individuals, separate from and in addition to diagnoses. I think they sense my compassion and my humanness, which I think includes a fairly good sense of humour. I feel honoured to have people share their very private, often painful stories with me. Often I have patients who reveal things to me they have never told anyone or have told only very few people. And I understand what a great responsibility I have to ensure their psychological safety from the beginning, throughout their assessment and their treatment journey with me. Psychiatry does come with challenges. It can be grueling, hearing of traumas people have endured, how much they're struggling day to day. Sometimes I have to have difficult conversations with patients about risk or alcohol or substance misuse, for example. And this can cause friction, at least initially. But what I would say is that anything worth doing will present challenges, and often it's the challenges that lead to the most significant opportunities to learn and reflect. Simply put, I love my job and I feel very lucky to have found psychiatry.